My patient was dealing with dizziness and migraine symptoms when she was in busy places, during really busy days, family events, things like that. And also had a lot of neck pain and dizziness with things around the house like cooking, taking care of her 1-year-old son. Let's talk about what she was dealing with, and I'll share a brief bit about what we did. It's gonna be hard to talk about everything. So she was one of those rare people that had actually treated a bit of this on her own and it had gone well. You know, when I tried to do that to myself, it didn't. Most people, it doesn't. But when we admit, she had really done pretty well to fix a lot of the little vestibular issues she had. But what was going on was a lot of visual dependence and some cervicogenic dizziness, meaning that her neck wasn't really doing a good job of being a balance system and she was over-reliant on her vision. So what we kind of needed to add to what she had already done on her own was working on correcting the neck issue. That involves finding what's tight, stiff, weak, correcting that. That's a big topic. There's no one-size-fits-all thing, or I would tell you if I could. And then we worked on breaking the visual dependence and getting her more confident in those busy visual situations. And she was able to really cut down on the frequency of her migraine episodes and get rid of the neck issues and dizziness associated with neck motion. So yeah, really fun case. It's always fun when it goes well. If you're curious about learning more, check out my webinar. I talk more in depth about how I treat this kind of thing.